The following are components of the foregut. The following are components of the foregut. A, stomach. That is true. B, rectum. That is false. Good. C, first part of the jejunum. That is false. D, first part of the duodenum. That is true. Right, so you just have to understand that the foregut will actually extend. So you have your pharyngeal foregut and your abdominal foregut, right? So the foregut will actually extend from the diverticulum of the liver bud, right? It's okay. But just take note of it. Take note where it ends. It ends at the junction. All right. You remember you have your duodenum, and your duodenum is the first part, second part, third part, and fourth part. The second part of the duodenum is actually straight. And on the medial aspect of the second part of the duodenum, you're actually going to have what you call a minor duodenal papilla and the major duodenal papilla. The major duodenal papilla is where the bile duct and the main pancreatic duct will actually pierce the duodenum. At that point, that's where we actually divide the duodenum into two. The area that is above the major duodenal papilla, right, will actually come from the foregut. The area that is below the major duodenal papilla will actually come from the midgut. So the first part of the duodenum is actually a part of the foregut. E, the appendix. That's definitely false, right? Good. Appendix is for the midgut. All right. Please, if you have questions, please ask. Well, we are too quiet. Is it making sense, guys? Is it making sense?
Yes.
All right, thank you. So let's continue. All right, okay. Right, so question number 5. Concerning the blood supply of the abdominal region. A, the epigastric vessels are located behind the rectum abdominis muscle. The epigastric vessels are located behind the rectus abdominis muscle. What do you think, guys? That is definitely true. Why? If you remember, okay, I'm just gonna rush through the course. First part of the subclavian artery, you receive your internal thoracic artery. Internal thoracic artery ends in the 6th intercostal space by bifurcating into the musculophrenic artery, which actually supply the 7th intercostal space, 9th intercostal space, 10th intercostal space, 11th intercostal space, and supply the diaphragm as well. And then you're going to have the termination or a continuation of the superior epigastric artery. So the superior epigastric artery will actually leave between the gap of the origin of the diaphragm. Remember, the diaphragm is 3 origin, right? There's a costal origin and a xiphoid origin. So there's actually a gap there where the superior epigastric artery is actually going to leave, entering the abdomen. When the superior epigastric artery enters the abdomen, it's going to enter the rectus sheath. Remember the rectus sheath that will surround your rectus abdominis muscle and the pyramidalis muscle. Good. So you have the superior epigastric artery actually being posterior to the rectus abdominis muscle. And then inferiorly, you're actually going to have the inferior epigastric artery, which is a branch of the external iliac artery. Right. So it actually ascends up, it enters the rectus sheath, it actually anastomoses with the superior epigastric artery, at the level of the umbilicus behind the rectus abdominis muscles. Right, so that was just a quick course for you. 5A, that is definitely true. B, the abdominal aorta commonly terminates at the level of L5. What do you think? That's false, right? That is the level of L4. L4, where it bifurcates, forming the common iliac. Hello? Is there a question? All right. C, the inferior epigastric artery is given at the level of L3. The inferior epigastric artery is given at the level L3. That is false. That's the inferior mesenteric artery, not epigastric artery. So you just have to take note of this. At the level of T12, you have the celiac trunk. At the level of L1, which we say the transpyloric plane, we have the superior mesenteric artery. At the level of L3, you have the inferior mesenteric artery. Then at the level of L4, you have the bifurcation of the abdominal aorta. Just like that. D, the splenic artery supplies the stomach and the spleen. What do you think? Right. So the splenic artery supplies the stomach and the spleen. That is true. And B, the splenic artery is the largest branch of the largest celiac branch. Remember, the celiac trunk gives us the left gastric artery, the splenic artery, and the common hepatic artery. And the splenic artery is actually the largest. The largest. E, the right and left renal veins are symmetrical. The right and left renal veins are symmetrical. What do you think? Right, this is actually false, right? So the right and left renal veins, they are asymmetrical. Why? So take a look at this orientation. You have the inferior vena cava to the right of your abdominal aorta. So the inferior vena cava is actually close to the right kidney, making the right renal vein short than the left. So you're going to see the left kidney is actually going to have a longer left renal vein, because it has to go to the inferior vena cava that is actually to the right of the abdominal aorta. So hence they are not symmetrical. That becomes false. Number 6, concerning the veins of the abdominal region. Concerning the veins of the abdominal region. A, the left gastric vein drains the lower third of the esophagus. The left gastric vein drains the lower third of the esophagus. What do you think? That is true. Right. So the left gastric vein also give a branch, which we call the esophageal branch, right? That will actually, so that's the artery. You're also going to have the esophageal veins actually draining into the left gastric vein, right? And take note, this abdominal esophagus, it's a site for portosystemic anastomosis. So if you have a hypertension of the portal vein, you're actually going to have varicosis, right, of the esophagus, due to like liver cirrhosis and so forth. B, the anal canal is drained by both the caval and the portal venous systems. What do you think? Right, that is actually true. So I'm just going to summarize areas with portal cover systemic anastomosis. You have to write them down. Right? One, the abdominal esophagus. Right? So in abdominal esophagus, you're actually going to have esophageal varicocele. Right? Esophageal varicocele. So you just write abdominal esophagus, esophageal varicocele, portal systemic anastomosis. Two, you're going to have the anal canal. So anal canal, you're going to have internal and external hemorrhoids. Internal and external hemorrhoids. Right? Then three, you're going to have in the anterior abdominal wall, that is between the following veins: paraumbilical vein, thyroepigastric veins, right? And this will actually lead to caput medusa. Caput medusa. Caput medusa. Then E, the left renal vein, and then the another side is going to be your bay area of the liver. So bay area of the liver is also a site for portal cover systemic anastomosis. Right, those four sites, very important. All right, so C, I'm done. Let's go to D. Oh, I'm done with B. Let's go to C. The hepatic portal vein is formed by the union of the splenic vein and the inferior mesenteric vein. What do you think? That is actually false. Right, so take note. Behind the body of the pancreas, you have the splenic vein joining the inferior mesenteric vein, right? Then behind the neck of the pancreas, you have the splenic vein, which have received a tributary of the inferior mesenteric vein, right? Joining with the superior mesenteric vein, forming the hepatic portal vein. And it is the hepatic portal vein that will supply about 75% of blood to your liver. Good. Right. Then D, the left renal vein drains the left testicle via the left testicular vein. What do you think? That is actually true. Right. So if you remember from the testis, right, from abdomen, you're going to have what called the spermatic cord. The spermatic cord is going to have the following, is going to have what you call the pampiniform venous plexus, right? So the pampiniform venous plexus, it's actually going to join like at the level of the deep ring of the inguinal canal and form the right, if it is the right, it will form the right testicular vein. If it is the left testicular vein. The right testicular vein drains directly to the inferior vena cava, since the inferior vena cava is to the right. And the left testicular vein will actually drain into the left renal vein, right? The left renal vein. And from the left renal vein, it actually drains into the inferior vena cava. You understand now? So that's where you can actually have a testicular varicosities. Sorry, it's testicular varicosities, where you actually have dilatation of that pampiniform venous plexus, if there is, especially if there is cancer of the what, of the left kidney, right? So that's another point to take note. E, the left renal vein is shorter than the right renal vein. We spoke of this, right? The left renal vein is actually longer than the right renal vein. Good. Right. Let's take a look at this one, question 10, and then we'll be done with this MCQ. Question 10, concerning the liver. Concerning the liver. A, the caudate lobe is anatomically part of the left lobe. The caudate lobe is anatomically part of the left lobe. What do you think? That is very false. It's very false. Why? Listen very carefully. The liver is mainly divided into the right and the left lobe anteriorly by the falciform ligament. Right. So you're actually going to have, if you see the visceral surface of the liver, you're actually going to have a caudate lobe that is superior and posterior, and your quadrate lobe that is actually inferior and anterior. So the caudate lobe and the quadrate lobe anatomically they are part of the right lobe of the liver, but functionally they are part of the left lobe of the liver, which means blood that drains or that blood supply to the left lobe of the liver will actually supply the caudate lobe and the quadrate lobe, because so the blood, the venous drainage and everything, right? Because they are functionally part of the left lobe. You understand? Good. B, the right hepatic artery is commonly larger than the left. What do you think? The right hepatic artery commonly larger than the left. What do you think? That is actually false. Listen carefully. The hepatic artery proper, which is going to be a continuation of the common hepatic artery, which is a branch of the celiac trunk, is actually going to divide into the right and left hepatic artery. The right hepatic artery is going to give the cystic artery. Remember the cystic artery. That's the cystic artery which actually going to supply your gallbladder. And then the left has to be bigger or larger than the right. Why? Because we say the caudate lobe and the quadrate lobe, they are part of the left lobe. And it is the left hepatic artery that supplies all the caudate lobe, the quadrate lobe, and the left lobe itself. So it actually has to be larger than the right. Easy. And all right. Number C, the Bay area is a site of the portal systemic anastomosis. The Bay area of the liver is a site of the portal systemic anastomosis. What do you think? That is
True.
Yes. Thank you so much. That is actually true. That is true. Is it? Right. Why? Because in the Bay area of the liver, you actually remember the Bay area of the liver is actually mainly on the right lobe, and a small part is found on the left lobe. It is made by the anterior and posterior coronary ligaments. So the anterior coronary ligaments, they are going to be made by the falciform ligament as it splits at the superior margin of the liver, and then the posterior coronary ligaments, they are going to come from the lesser omentum, right? So the anterior and posterior coronary ligament, to the right, they're going to join and form the right triangular ligament. To the left, the anterior and posterior coronary ligament, they're going to form the left triangular ligament. And between that, you're going to find the Bay area. And within the Bay area, you're actually going to have your inferior vena cava, as it receives 3 hepatic arteries, right? 3 hepatic arteries. So that's the site for postal systemic anastomosis. That is true. D, the attachment of the falciform ligament divides the liver into right and left lobes. That is true. Good. E, last one, it containing the liver, it is related posteriorly to the right kidney. That is very true. The right kidney actually have an impression on the visceral surface of the liver, together with the right suprarenal gland. You understand? Good. Right. So uh so that's all that um I have for you today in terms of gross anatomy. In terms of gross anatomy, right?